Good day, this is Carla. I'm a physiotherapist, and I'm going to talk to you about how to prepare for your total knee replacement. So, why do we even bother preparing, and why do you have to listen to all these videos from the nurses and physios before your surgery? Well, it's like preparing for an exam, right? You want to study in order to do well. So, we want you to obviously have a great experience and a successful surgery, and of course have less stress because going to the hospital in general is a stressful experience. So how are we going to get into the hospital for your surgery date? On that day, you're going to come through the main new building, the Polson Tower, like you have been for the last couple of years during the COVID season. Now, of course, if you've had COVID in the last 7 weeks, the doctors or the anesthesiologist will postpone your surgery because we want you to be healthy in order to be successful at managing your surgery. Of course, visitors still have to prove vaccination status, but most often people don't have too many visitors because they're only there in the hospital for one night. So you'll have many different team members caring for you. Obviously, your surgeon, various nurses and LPNs, and physiotherapists will visit you the next day, as well as a rehab assistant to go over your exercises. And if you'd like to use our pharmacist on your way out, that's where you can get your medications right outside the door where you leave. So during your hospital stay, it's going to be very short, really. Most people only stay one night, and that's what you have to expect, to stay only one night. The odd person, maybe 5% or less, will stay 2 days, just usually if there's a bit of complications such as pain control, or perhaps you've lost a little too much blood, or you're a little weak, or other things that went on. But for the most part, people are leaving after one night stay. Occasionally, if you're doing a half knee or a uni knee, you might even leave the same day. But for the most part, you're leaving after one night. So what kind of things are you going to bring? You're going to bring your loose fitting clothes, so you're able to get your clothes over the bandage. So you're gonna have kind of a band-aid, so a pair of pajama pants or shorts or a skirt or something that's loose that can go over them works well, or jogging pants. What you do want to bring is a pair of shoes or Crocs or some kind of slippers that are one size larger than your regular foot size, because often your foot during surgery will swell and it's very hard to get into your running shoes. So you want to do that. You want to label everything that you bring, including your crutches. Maybe put a masking tape on the crutches that you borrow from Red Cross. You need to bring your crutches to the hospital, but you do not need to bring your walker. We will loan you our walker while you're in the hospital. Of course, you want to bring your cell phone if you have one, so you can talk and let your family know that you're out of surgery. So most people say to me within the first few weeks after surgery, I wish you would have told me how much pain to expect. There's a lot of pain with this surgery. And that's especially those who maybe don't have as much pain going into surgery. It's quite remarkable. So that's why we talk a lot about pain control and taking your pain medications and managing pain. So some of you may be getting a nerve block, which is amazing. It'll give you 12 or so hours of some relief, but after it disappears, you need to have oral pain medications in your system, or else you may be in a crisis. So be aware. Make sure before you go to sleep that night when you're in the hospital that you make sure you're taking your pills orally by mouth before you go to sleep. Often people have nausea. The narcotics and even the anesthetic sometimes makes you feel kind of upset in your stomach. So let the nurse know and see if a gravel or some other medication is helpful. And also constipation is a common thing as well with narcotics. So plan for that. Make sure you have gentle laxatives at home, or maybe a stool softener. Talk to the pharmacist about options. And of course, water and fiber and fruit and prunes and things like that also help. Bruising and swelling is very common, and it's something you battle with, especially the swelling, for weeks. And we'll talk more about that later. The bruising can happen anywhere from your hips all the way down to your toes. In surgery, when the surgeons even grab your leg, right, you'll have sometimes marks from them just kind of stabilizing your leg. And that's a common thing, but they disappear, the bruising. So on day 0, usually is what we call your first day of surgery, right? The day you've come into the hospital. Usually the surgery itself will only take an hour, hour and a half, but you'll spend a couple hours in the recovery room and when you're done your surgery. And then you'll find yourself attached to various tubes and things. Most often the IV is in your arm. Sometimes you have a nasal prongs, and obviously you have a bandage on your knee. And occasionally you'll have a wound drain or a catheter, but that's more uncommon. As soon as you're done in the recovery room, you'll be going up to our surgical ward at Vernon Jubilee, which is on the 3rd floor of the old building, which is the Jubilee building. And hopefully, we assume that day you will be up and standing and walking to and from the door with your walker with the nurse. So just so you know, that's what we expect. We expect that you will, for the first time at least, with supervision, that you're taking your walker and going for a short walk to and from the door. You'll be sitting up in your chair for all meals, and you'll be starting on your exercises, those range of motion exercises of bending and straightening your leg that we've given you in your pamphlet, in your email, and also some of them are written in your booklet that we've sent via email. So usually the first ones that you're supposed to do are on page 30 and 31 of your actual email that you've been given. But you also want to be doing your deep breathing and coughing exercises. So every hour, right, you're supposed to be doing those deep breathing, coughing exercises, 5 to 10 at least every hour, where you're taking deep breaths in through your nose and out through your mouth, like you're kind of in yoga class, right? Making sure you're clearing your lungs out, and then coughing too, like this, a couple times an hour. We just want to prevent complications like pneumonia, which is a complication of any surgery when you go under. And so that is what you have to do until you get active, as well as those tightening thigh and buttock muscle exercises that we talked about in the booklet. So it's like you're tightening your thigh muscle while you're even lying in bed, pushing your knee into the bed, holding for 5 seconds a couple times, at least 5 to 10 or so every hour, and tightening your buttock muscles like you have a quarter between your cheeks, holding for 5 seconds every hour until you get more active. Another one is the foot and ankle exercise, where you're pumping your ankle back and forth like you're stepping on the gas. Again, it increases your circulation, so you're preventing blood clots, which is a complication of surgery. So we're going to give you various, over the course of your couple of weeks of physio, you're going to get bending and straightening exercises. So it's not rocket science, it's just bending or straightening your leg. And it's very important that you do these exercises for the first few weeks. So the pamphlet that we've given you online, and also we will give you a hard copy in the hospital, those are your first basic exercises. So it's your ankle pumping, it's your thigh tightening, it's the one where you're bending and straightening your leg in various ways. Usually you're going to do them 10 times slowly, and you want to do them 3 times a day. So 3 sessions a day of doing your exercises. The one that's most difficult most often is the one where you're straightening your leg over the roll, when the roll is underneath your knee. Often what happens is it's really hard to lift your leg because your quadricep muscle or your thigh muscle has kind of become a little slow or sluggish during surgery because of the swelling. So you still want to try to do that. And often I tell people to try and get your partner to try and help you lift your leg with a few fingers. And over the course of the week, usually your thigh muscle or your quadricep muscle will start working again. So then by the time you see physio, all things look good in the outpatient department. So just the day after surgery, just so you know, you'll be usually leaving home at around 10 a.m. in the morning after one night in the hospital. And before then, the physiotherapist will help you review the crutch walking and stair climbing prior to leaving the hospital. And then on leaving is when you go and grab your medications prior to leaving the hospital, if you don't want to get it from your regular pharmacy. So in terms of from the physiotherapy therapist perspective, your only job that we want you to do for the first 6 weeks is to bend and straighten your leg and to walk kind of with a normal gait with whatever walking aids you require. So really, you're bending and straightening your leg over and over again until you get the right results. So if you look in the first picture, you see that leg is nice and straight. You can't fit a finger underneath his knee. So there's a bunch of exercises that we'll go over and try and work on that. So it's very important you do not put a pillow under your knee just to rest your knee, because then it'll cause that knee to bend. And you see in the bottom picture, you have about 120 degrees in your knee there. So it's in terms of what we expect, that's what we want for sure by about the 5-week mark. 120 degrees is all your joint replacement usually gives you. That's just the way the prosthetic or the actual implement works. It doesn't go much beyond 120. So when you get 120 degrees of bending or flexion, we're very happy. What we do expect at the 2-week mark, or by the time you see your surgeon for getting your staples out, we need to see 90 degrees of bending at the knee. So that's like you're sitting at a chair normally, where your knee is bending at 90 degrees. So those are the expectations for the first 6 weeks. And of course, what comes in the way of doing your exercises is pain. So that's why we talk about managing your pain all the time, because we don't want any excuse for you not to do or be able to do those exercises, because those are very important within the first 6 weeks. So you want to take your pain medications very regularly, and sometimes, you know, your partner or your helper can help you kind of keep track of how often you're taking them, because you want to have to be very regimented. Most often people are on tramadol initially, which is kind of like a quasi or fancy kind of a Tylenol #3. It's like a lighter narcotic. And also sometimes they're on Tylenol extra strength as well. Those are the typical ones that people start on. And eventually you want to try and, over the first 2 weeks, get rid of your narcotics, which is the tramadol, and then ramp up or keep taking your Tylenol extra strength, or acetaminophen is what they're called. Some people are allowed to take an anti-inflammatory as well, such as ibuprofen or Advil, but you have to make sure you're able to do that, because a lot of people have high blood pressure or heart conditions or other things that prevent them from taking that medication as well as Tylenol. So please talk to your pharmacist or doctor about your pain medications. At all times, your pain should be at the stage of around 2 or 3, so kind of in the mild zone. If it's anything more, like it's getting worse, you have to ask yourself, gee, what should I be doing, or am I doing anything wrong, or what else can I add to my treatment plan? Do I need to put my leg up more and elevate it? Do I need to ice my knee? Am I doing too much walking, or am I not using my crutches enough? All these things need to be asked. Again, I'm just going to talk about the bruising and swelling because it's very common. What happens is if you sit for longer than 30 minutes at a time, you tend to get a swollen knee. So that kind of happens for the first couple of weeks. So sitting 30 minutes is okay usually, but beyond that, people start feeling their knee swells up a bit. So that's a factor. You also want to use ice if it helps you, because usually it helps for pain and sometimes a bit of swelling. So using an ice machine is awesome, which you can get them. They're quite pricey, but they're about $350 or $400 to buy. They're called cryo cuff machines. But so sometimes people will lend people theirs or buy them or rent them from a medical supply company. They're great. You don't need to use those fancy machines, even though they're great. You can just use a gel ice pack as well, with a barrier, at least kind of a damp tea towel underneath it, so you're not going to freeze your skin. So that's important. So you use ice about 10 minutes at a time, a couple times a day for sure. So most people use it at least 3 times a day, because if it's helpful, and some people use it more often than that. And it's usually really nice to use after you've done your exercises. And sometimes people also find that their muscles are really tight. So sometimes people will use a combination of ice and heat. So they might warm up their muscles, like their thigh muscle, a little bit with some heat for a few minutes before exercise, and then use ice on their knee after exercise. And that works really well. So what I want you to look at is this picture. It's a very important picture, because what happens is your knee is so swollen for the first couple of weeks that it's really hard to manage the swelling. So if you use gravity by lifting your leg up in the air, high on a pillow, a pyramid of pillows, this helps quite substantially. You can see that the knee is really straight, so there's no bend in the knee, and the gravity is assisting that swelling to go down into your thigh. So that's what we want. We want that knee to get, to be as skinny as possible, so you're able to bend that knee. It is very hard to bend a swollen knee. So that's why you'll find yourself in the first few weeks, when you're resting, or after you've done your little, like maybe you walk to the kitchen a few times, and then you've sat for 20 minutes, and then you have to rest, right? Then your knee's a bit sore, you put it up in the air for 20, 30 minutes, throw some ice on it as well for 10 minutes. And then you're going to be doing this back and forth for quite a while, and it's going to be a very boring life for a little bit, but it usually is quite helpful if you're going to elevate your leg like this. The good thing about this surgery is that you're able to weight bear on your leg as soon as you've had surgery, which is great. So it's called weight bearing as tolerated. So you're able to put your foot down and walk. But obviously it makes sense to use a walking aid because you want to offload some pounds off your poor knee that has just had surgery. So you're offloading it with your arms using a walker, crutches, eventually maybe walking poles and a cane. So we'll help you kind of progress from one to the other. But initially, we assume everyone is going to use a two-wheeled walker initially and or crutches. So I'm going to just explain to you kind of how it works with a two-wheeled walker. So here's a picture of a two-wheeled walker. I'm gonna, so you can see these pants that are rolled up, that's their operated leg. So you're stepping in, you're rolling the walker ahead, and you're stepping into the middle of the walker with your rolled up pant or your sore or operated leg. So I always say it kind of looks like you're a 1980s bridesmaid, the way you're walking, kind of, you know, nice and slowly, you're advancing the walker, you're putting your leg, your sore leg into the middle of the walker first, putting weight through your hands, and then you bring your other leg down. So here's the similar kind of a way in how you're using crutches. If you look here first, when you're adjusting the crutches, you want to make sure it's not too tight on your armpit. So usually 2 finger widths is a good idea. And then where your the handle is, where you're going to put your hand on, you want to have it situated where your wristwatch would sit, or maybe where your wrist will bend. So similar way, again, the rolled up pants is where your operated leg is. So you're putting or advancing the crutches and putting your leg at the same place, your sore leg at the same place where the crutches are. So it's crutches first, operated leg, then good leg. Crutches, operated leg, good leg. Crutches, putting weight through the arms, you know, with the operated leg at the same time. So that's how crutches work. And we will also get people to go up and down the stairs before they leave the hospital. So it's kind of like your ticket to leave the hospital. This is a good idea to practice before you leave, before you actually go into the hospital, just so you know the sequence. So I'll go over the sequence here. So again, your good leg is the full pant there, right? So we always say a little way to remember it is the good go to heaven, the bad go to hell. So coming up the stairs, you're leading with the good leg. And going down the stairs, you're leading with the bad leg, going down first. So again, you're going to hold on to like a crutch or the railing, obviously. And coming up the stairs, you're leading with your strong leg or your non-operated leg. So the good leg comes up first, and then the operated leg. And you're leaving the crutch kind of at the bottom of the stair first. So coming down the stairs, you're always leading with the operated or bad leg first, with the crutch or cane. Coming down the stairs. So it's the good go to heaven, the bad go to hell. So coming down the stairs again, you're using you're advancing your sore leg first with the crutch, and then you bring your good leg. So I bring this picture in for this reason, just to think about how you're going to get in to your vehicle and who's going to pick you up. So sometimes people will have, their son-in-laws picking them up from the hospital, and they may have a huge truck. And if you're really short, you have to think about how am I going to get into this truck, right? So some people, or even if it's a low car, you might want to bring some kind of a high density cushion just so you can have a little more comfort while you're driving. So you want to, especially if you have long legs, right, you want to make sure that you're not twisting your knee. So this is a way that when this gentleman is getting in, he's had a hip replacement, but the farther you put your seat back is helpful. And yeah, any twist in your knee obviously is going to be sore, so you just want to avoid that as much as possible. Some of you may have a longer journey coming home, like if you're going home to Revelstoke or maybe even Salmon Arm. Sometimes people need to get out of the car every 20 minutes or so when you're taking the long road home. So that's a factor, and it actually makes a difference. Before you know it, you will be home sweet home. And you'll be wondering, where's my physio? Or when does physio start? Well, the thing is, you should have started your physio in the hospital, and ideally even before surgery, that you would have been doing your exercises prior to surgery. So really, you are your own physio. But we do have physios here in the hospital, and there's ones in private practice that will be your coach. And they're basically there to make sure you're making your goals and making your mark, kind of meeting certain milestones at the right time. So we're there to prod you along. or maybe even tell you to maybe lay off a little bit. Maybe you're doing too much, or you're walking too much and not focusing on your bending and straightening exercises. But we're there to kind of let you know how you're doing. So in Vernon, we will contact you within the first week of surgery. So you'll get a phone call, physiotherapy visit, on the phone. So we'll chat and see how you're doing and kind of troubleshoot your exercises over the phone. We'll then hopefully book you for the following week on week 2, and we try and coordinate it with your staple removal. We tend to see people about once every week for the first 6 weeks. And then after that, you have an option to do a gym program, or some people will do their own program in the pool or things like that. And then we might check back with you maybe at the 2 or 3 month mark as well, and make sure you're on track. So your exercises, I mean, your whole day will kind of contain a lot of exercises, a little bit of walking, not much indoor walking, limited sitting, a lot of elevation ice, and medication. And you repeat times 1,000. It's going to seem boring, but that's the way life is for you for the first 6 weeks. It's a hard first 6 weeks. Just so you know, put on your calendars as soon as you get home from the hospital. It is your job to book your staple removal by your orthopedic surgeon. So you want to call their office the day you get home to book an appointment, which should be about 10 to 14 days after your surgery. So this is a very exciting time, because then all your staples can get taken out. You might want to take a Tylenol half an hour before you get your staples out, because some people feel like it's a bit painful as you're taking out 40 or 50 staples. But it's really nice to get them out, because then your knee seems a bit more flexible after that happens. But just a reminder, that is your job to do it. Just a note, some of the people that are in remote areas always wonder, can I get this done by my GP or my family physician? It is an option, but not recommended. Every surgeon wants to see your knee at the 2-week mark. It is kind of their baby. They've done the surgery and they want to make sure that wound is looking good. So if at all possible, it is the expectation that you come back to Vernon Jubilee Hospital to have your staples removed. If you have an exception, or if you need an exception, you have to clear that with your surgeon for that reason. All right. So at Vernon Jubilee Hospital, this is one thing we offer. It's kind of a circuit training or gym program that's free. So at around the 6-week mark, we offer this to people that want to go. It's held at Cal Fitness Center, which is in the Alpine Center on Calamalca Lake Road near Cal Lake. So that's a nice little program that's run 1 hour a week, and it's for 6 weeks straight. And it's just a nice transition program for people that want to push it a little bit more, maybe to go back to work a little stronger, or maybe hit the gym again or do other things. I just want to mention that the total, total joint replacement surgery, the total knee surgery, is more like a marathon than a sprint. A lot of people, maybe they've had other surgeries that they really kind of came out of really fast, whereas this one is a longer one and it takes a bit of grit. So often what happens is a lot of women get a little discouraged around the week 3 and 4 mark. They get weepy, and it's very common. So just because it's hard, right, to not doing your regular stuff, not doing your regular chores, and be as efficient as you normally are. And I find men, you often get discouraged around the 5 or 6 week mark, because by then they're getting cabin fever and they want to do more in their shop and things, and they're still not able to do what they want to do. But most people feel a whole lot better after the 6 week mark, because then they can start to sleep a bit better by the 6 week mark, and things look a whole lot brighter. But the first 6 weeks is hard. So I want to let you know that in advance, because this is what people say. It's a reality. So just so you know, often pain medication such as Tylenol, most often, is needed for 6 weeks or more. So some people still need to take the occasional Tylenol in order to manage their exercises and make more goals, get themselves stronger. So that's a normal thing. So everyone's different. So you have to find your rhythm and your how much you need, if you need it. In general, what I do find is people that have had a lot of pain in their knee, like arthritic pain before surgery, feel a bit better. They seem to have less pain and do a bit better in the early stages after surgery. Whereas the people that don't have a ton of pain going into surgery, like maybe they only get pain when they're hiking every once in a while, or sometimes at a lock once a week, they will feel more pain during, or the days after surgery. But eventually people are quite happy, a lot more happy by the 6-week mark and way more happy by the 3-month mark. So your joint will continue to swell and be warm for 3 months to 6 months, easily. So that's kind of an ongoing battle that you have to kind of manage. And what we do recommend is most often you're going to need to walk on level surfaces for the first 6 weeks. You're not able to manage inclines or hills or anything like that for the first 6 weeks. And in general, people that go back to work, most people won't go back to an office job until at least the 6-week mark. That's the very minimum I would suggest, if at all possible. If you have manual job of sorts, it makes the most sense to kind of wait almost the 3-month mark before you go back to a manual job. And what I do find is that people who go back to work a little too early end up not doing their exercises, having a harder time. You just don't have the time to do the exercises properly if you go back to work too early. And that includes more like an office job, because sitting isn't great for the knee, definitely within the first 6 to 8 weeks. It's really hard on the knee. It really makes it swell quite a bit. So chat with your doctor or your physio about your return to work if you're going back. So the good thing about this knee replacement is there's the whole idea why you're doing it is because there's good relief of pain in the long run. That's the whole reason why you're getting this done in the first place. So after 3 months of pretty impressive and intense rehab, people are quite a bit happier. So I always encourage people in the early stages, if you can, try and borrow a stationary bike just to leave in your place, or even buy one of those under the desk bikes that you can buy on Amazon for about $100 if you don't have the room for a stationary bike. It's a great way to keep yourself in shape while you're rehabbing over the 6 months to a year. Often people also like to use the aquatherapy class at the Vernon Rec Center. That you can only do that after the 6-week mark because the surgeons want to make sure that your knee is healed nicely before you go into any body of water. That includes the bathtub. To submerge your knee in a bathtub or a pool, you need to wait to the 6-week mark. And that includes driving as well. For the most part, especially if it's your right leg, you do not want to drive before the 6-week mark because it takes 6 weeks to surgically knit together your wound. So it makes sense to wait until that happens. But always talk to your doctor if you're having concerns about this aspect. So just a quick little note, you should have read in that booklet that you were sent on your email, which is about 40 pages. It's called Before, During, and After the Knee Joint Replacement Surgery. You should have read about the red flags. So some of the red flags that are important to note are the signs of infection. So the heat, the redness at the incision site, smelling, fever. By the time you get home, you shouldn't have a ton of drainage coming off your bandage. If you are changing your bandage frequently or a lot over the next 2 days, that's a problem. It shouldn't be bleeding a lot. It should pretty much be dried up by the day or two as you get home. If it is not, go back to the doctor or check in with the doctor. You'll have swelling in your leg for sure, but if you have a ton of swelling that's all of a sudden and all the way down the leg and quite sore and behind your calf and your knee, that's potential sign of a blood clot too, and you want to get into the ER to get an ultrasound just to make sure it's not a blood clot. Other things that go on, potentially, constipation is a factor. So if you've not had a bowel movement for more than 4 days, you want to, before that, hopefully talk to the pharmacist and get on some kind of laxatives and things. But if it goes beyond that 4 or 5 days, and that becomes more of a concern, and you want to talk to your doctor as well. You should always have pain that settles with pain medication or interventions like ice and elevation and rest. So if you have pain that doesn't seem to settle, it's always sore, just nothing works, that you have to talk to your doctor about that too. You should always have the ability to put some weight through your operated leg. If for some reason you can't, or it doesn't feel like you can put any weight through it, that's something you'd need to talk to your doctor about. And of course, with any sudden shortness of breath or chest pain, that is a reason to get into the emergency without question and as soon as possible. Obviously, that's the sign of either heart attack or blood clot to your lung. So there's the scary part of what we need to talk about. But you've already been emailed about your equipment needs. Now, So you should email back and make sure that you're clear on what you need and which depot you're going to get the equipment at. Everyone needs a two-wheeled walker, a pair of crutches, and a raised toilet seat, especially if you're over 5 feet tall. So those are the kind of the given things that people need. Other options are just bonus things for some people, like a handheld shower, obviously a non-slip mat. Some people like a bed assist bar if you have trouble getting out of bed, but that isn't usually required. So the things that you need for sure are the two-wheeled walker, crutches, and raised toilet seat. And some people really like a bath bench or stool or tub transfer bench, which is that top picture, especially if you do not have a walk-in shower. So it's a lot easier to get into the bathtub. So that's a handy feature as well. But some people, if they're not feeling safe to get into the bathtub within the first week or so, just have a sponge bath. It is way better to have a sponge bath than to slip into the bathtub. So just always make sure safety is a factor first. Other equipment that's helpful is obviously a cell phone, portable phone of sorts, and a chair with an armrest is a really nice idea because you're always, trying to push off the chair to assist your knee. So some kind of dining room chair with armrest is a nice feature. I just want to mention also to avoid falls. Now, this seems obvious, but the stats are fairly high. I read an article once where they said 28% of people, I think, within the first couple of months of any joint surgery, total joint surgery, fall. So that's high. That's almost 1 in 3. So I do find a lot of people fall, but they tend to not hurt their operated joint. They end up hurting their back, their pride, their other leg, because you're trying to avoid hitting your operated leg. So it happens usually for the young. I feel like the younger people tend to be the ones that fall at around the 3-month mark, 2 or 3 month mark. And it's often because you're doing things a little too fast. Often your muscles aren't fast enough. They've not got the speed or strength yet to do things as fast as you used to. So sometimes it's just when people are not paying attention, slipping down the stairs, doing things too quickly in the middle of the night or outside. So be very wary of falling, and be careful really for the first really many months after surgery, especially during the first couple of days when you're a bit dizzy because of the anesthetic potentially, or even the narcotics that you're not used to. So just be aware of that. So in summary, what you are required to have is obviously transportation home from your buddy that will be with you, or whoever is going to pick you up that day after surgery. They need to be available that day after surgery, and potentially the day after if for some chance you are in longer. As well, you need that support person, very important. They say 48 to 72 hours, ideally a whole week, right? Because things are hard for that first week. Normally, right, as you know, 15 years ago, people were in the hospital for a total week after the exact same surgery, and now you're leaving after 1 night. So it makes sense that you have a support person with you. And then you obviously want to get your equipment in advance, maybe a week or so prior to surgery at your Red Cross depot. Be sure when it's open. Typically, they're only open in the morning and they're run by volunteers. So please be kind to your volunteers. And it's nice sometimes to let them know that you're coming in advance so they can get your equipment ready in advance. All right, so I wish all of you well on your total knee replacements, and I will see some of you in the department later on, and wish you all well. Take care. Bye-bye.